Welcome to today's lesson. Today we are going to discuss communication skills in leadership and management in nursing. It is very important for you as a nurse to have a good communication skills because whatever we do in our profession relies on communication. There's a common saying which I love which says, work which is not documented is work not done. Today, we are going to discuss Unit 3 of Leadership and Management, where we are going to discuss communication skills. My name is Kelvin Sikombe. I'm a registered nurse, as well as a transformation leader and an author. What is communication? And what are we going to learn in this lesson? So, we are going to discuss the definition of communication, types of communication, the communication process, interpersonal relations, as well as team building, the process and the importance. So I urge you to pay attention. Make sure you have a notebook by your side so that you can be writing down some of the points. So what is communication? Communication is simply the exchange of information from one person to the other. The first definition there is saying communication is referred to as a two-way process of exchanging or sharing ideas, feelings, and information. I like this definition because it includes feelings. You know, some girls, just by looking at you, the way they move their eyes can tell something, can communicate something. Our body language itself can discuss or share some information about ourselves. So that's why I love this definition, because it says it's a two-way process of exchanging or sharing ideas, feelings, and information. When you reach at a patient's bed, when you give out that smile, you give the hope to your patient, you are trying to communicate. You know, a nurse who smiles at a patient and says, things will be okay, and a nurse who does not smile and says, things will be okay, there's a difference there. So communication is a process of exchanging or sharing ideas, feelings, and information. Communication is also the exchange of information between individuals through a common system of signs, symbols, or behavior. The other simple definition is just the act of transferring information from one place to another. That is the simplest definition of communication. It is simply the exchange of information from one place to another. What are the types of communication that we have? We have verbal communication. What I'm doing now is I'm talking to you. This is verbal communication. You are seeing something written on your screen. That is written communication. So this is a mixture of verbal, written, and visual, because you are able to see. So we have verbal communication, which is through speech, non-verbal communication, which includes symbols. We also have written communication, whereby I put it in written and send it to you. That is the written communication. We also have visualization. So the desired outcome or goal of any communication process is understanding. The reason why we communicate is we want another person to understand. The reason why we write a report after each and every shift is because we want the next nurses who are coming in the next shift to understand what happened in our shift. So every time we are communicating, keep it in your head that this communication, its intention is to make someone who understand. Every time when you write a message, every time when you speak, make sure you speak in a way that makes the other person understand. Remember the following. So, one-way communication, this is where information is just going and not coming back. We call this didactic method. So in an organization, information is coming from the nursing superintendent, coming to the nurse in charge, and then to nurses in the wards. But information is not going back above. That is didactic method, one-way communication. Then two-way communication is where information is going as well as the information is coming back. That way we call it Socratic method. So that is it. So one-way communication This can be used, for example, you are in charge and then something has happened. Let's say an emergency has happened and you want nurses to act there and then. So you communicate to your nurses, can you please start reporting at 7 hours from tomorrow because the ward is being congested. Instead of reporting at 7:30, start coming at 7 hours. And it ends there. The nurses are not supposed to ask questions. That is one-way communication, didactic method. But in a case where a nurse in charge comes in and said, my nurses, we have seen that we're having a lot of people in the ward, and we report at 7:30. What can we do so that we help decongest the ward? Then the nurses start asking questions, suggesting, can we do this, can we do that? That is two-way communication, Socratic method. Someone is asking and someone is receiving feedback. But in didactic method, it's just about giving instructions. Then we also have written communication. These are reports that we write in the word. You write a report, that is written communication. We also have formal communication, which has downward and upward. So information is going up and downward. This is self-explanatory. Then we also have informal communication, which is grapevine. So grapevine refers to the informal and unofficial flow of information within an organization or group. So this one, it's about nurses. They say nurses in the world spreading rumors. Maybe we know the in charge wants to increase an hour to our working schedules. Rumors going around. So this can come in one way dancer and say type of communication which involves the nurses discussing things and spreading rumors is referred to as what? It is grapevine. You must be quick. You must be very quick when you notice that to spot it as the grapevine. Then we have what we call the communication process. How does communication flow? So we have this communication process. It begins with the sender. So the sender expresses. Then there must be a medium in which that information will be transmitted. Then the receiver will interpret that information. Then there will be feedback, which will go back to the sender. So this is just a simple flow of communication. You send the information. For you to have that information reach the person you are sending to, there must be a medium. Then you receive feedback and it will go back to the person who sent the information. That is communication. So this is the communication process. So when you're explaining, let's say in an exam, we are talking about the sender, you have to talk about that the sender is being the source, or you say the person who initiates the message. This person thinks about what they want to communicate. There's what you call encoding. So the process of turning thoughts into communication, which is called encoding. So someone will have to select appropriate words, tone, and body language to express the message clearly. That is called encoding. Then the medium, which is the channel through which information is going to be sent. In our nursing, the common channels will include face-to-face conversation. You are reading the report in the morning to your fellow nurses who have come in the next shift. Written notes. Sometimes our friends in private hospitals even make phone calls. Such is a channel or a medium in which information will be transmitted. Then on the receiver here, the recipient will receive the information and they will have to decode. We call it decoding, the process by which the receiver interprets or makes sense of the message. They try to understand what is being said in this message. Then they will have to interpret that message and understand it and then give a good feedback to the sender. That makes the communication process. Then we also have principles of communication. Exams nowadays are very funny. Someone will just tell you that explain the principles of communication, and people will be frustrated. We didn't learn this. So what used to help me when I was a student is to understand the word principles. A principle is just something that guides something to happen. So what are some of the principles you've put in place for you to be an effective learner? Maybe you've said, I won't be copying the notes as they are, as I am learning from someone who is using a PowerPoint. That is a principle you've said. It is a guide to help you learn well. Maybe you've said, I have to be in a free environment. If there is noise, I have to be in a free noise environment. If there is noise, learning cannot take place. That is a principle that you've put in place. And for you to make sure that you reach that principle, what do? Maybe you wake up at night when everyone is sleeping. So a principle is just anything that is guiding. When you look at communication, they say principles of communication. Ask yourself, what are some of the things that can guide communication? Number one, clarity and simplicity. You must explain information clearly and in a simple way. There must be clarity. When you say the pulse is 200 beats per minute, and someone who just said the pulse is 100 what? So clarify, okay, this pulse is in beats per minute. If it's temperature, you can't just say 38. Say 38 degrees Celsius. You write it very well. Clarify so that we know. What if that temperature, the 38 you wrote, was in Fahrenheit, which is different? So you must make sure that you clarify and you write your information in a simple way. Active listening. There is nothing which is as beautiful as listening. One of the core factors in communication is you have to listen. Listen with your eyes, listen with your ears, listen with your touch. That is a goodness. So in communication, active listening is a principle. Empathy. You have to be empathetic in your communication. Respect. You have to respect the person you are talking to. Good non-verbal communication. If you are sending a message to a patient, there must be some good verbal, non-verbal communication there. Smile where you need to smile. If you need to show that you are also affected, maybe you are going to tell this family that their person or their loved one has passed away. Are you going to go there smiling? No, you are going to chill with a cool voice. It is so unfortunate. We've tried our best. We have lost your loved one. Feedback and validation. Give feedback. Privacy and confidentiality. These are major things in communication that we have to follow. Barriers to effective communication. Language barrier. If you speak Tonga, I speak Bemba, and you don't understand any other language, we are going to struggle with communication. So we will need a common language like English for us to effectively communicate. So in a case where you cannot understand certain language and the person you are trying to talk to does not understand your language, that is going to be a barrier. Psychological barriers. When I am psychologically ill, I have lost a loved one, I am sick, understand that my psychological capacity is not okay, and that might affect communication. That's why as nurses we are advocates, because we do understand that when our patients are sick, they are not themselves. Physiological barriers. Maybe my physiology is not well. My ears are not good. I cannot see. There must be a way of communicating to me in a nice way. Otherwise, that is going to be a barrier. How is my attitude? Attitudinal barriers. If I do not have a positive attitude towards what you are trying to communicate to me, I am not going to listen to you. We also have physical barriers. Sometimes you are very far from me and I can't get to you. Other barriers of effective communication are the use of jargon. You start using complicated words. No. Take your English somewhere else if you are so advanced in English. Use simple words to communicate to me. You can't go and tell a patient that uh, you are in tachycardiac, you are at the way we say that the high pulse is tachycardia, then you say, you are having tachycardia. They are not going to understand. But if you say your heart is beating very fast, they are going to understand. So use simple ways. Emotional barriers and taboos. So there are some of the emotional barriers. Some people are too emotional when they are sick. Lack of attention, interest, distractions, or irrelevance to the receiver. All these might affect communication. Cultural differences, poor timing. You must have a good timing when you're trying to communicate something. Not just anyhow you go and start communicating. Noise, information overload, all these things. How do we improve communication and overcome barriers? We must learn to listen. Be aware of others' emotions. Empathize. Encourage other people that this information that I'm telling you is very important for you. Communicate effectively. Use humor. Treat people equally. Attempt to resolve conflict. Maintain a positive attitude and smile, as well as minimize stress. These are some of the ways we can improve communication. It is not something that is complicated. Let us now move to interpersonal relations. An interpersonal relationship is a strong, deep, or close association between two or more people that may range in duration from brief to enduring. In other words, it refers to the manner in which people respond and identify with each other in the situation of everyday living. This, interpersonal, we are just interpersonal. Personal, it's us human beings. Then inter is between two. So just talking about the relationships which are between two people. So these are the interpersonal relations. And as a nurse who has done leadership and management, you have to be able to know how people relate to each other. This is what we call interpersonal relationship. So they are regulated by law, custom, or mutual agreement and are the base of social groups and society as a whole. How do people relate to each other? When you are sent to a district, at a district hospital which is new to you, the first thing you have to see is how are people relating to each other. Are they friendly? How do they communicate information? What are the customs here? What is the law? How do they agree with each other? You look at the social groups, that is interpersonal relations, and it is very important for you to understand this interpersonal relationship. They'll ask you in leadership, can you explain the importance of understanding interpersonal relationship as a nurse? Then you get confused, we didn't learn. So just look at the word interpersonal relations. So interpersonal relations, that's just a relationship between people. Then understand that it is very important to understand how people communicate, relate to each other, so that you know how to deal with them and how to even provide healthy care to them. So development of relationship follows the following stages: acquaintances and acquaintanceship. Becoming acquainted depends on previous relationship, physical proximity, first impressions, and a variety of other factors. If two people begin to like each other, continued interactions may lead to the next stage, but acquaintance can continue indefinitely. Praise build up. So during this stage, people begin to trust and care about each other. Yeah, so you begin to build up your relationship. Then there's continuation. This stage follows a mutual commitment to create a strong and close long-term friendship. So 3 types of relationships that I know: reciprocity. I give you a biscuit today, tomorrow you help me with a biscuit as well. We are reciprocating. This is the ideal relationship. This type of relationship is characterized by loyalty, self-sacrifice, mutual affection, and generosity. This friendship is based on equality. Then we also have receptivity. In this type of relationship, there's an imbalance in giving and receiving. Someone just wants to be receiving, and the other one is a giver. That is not healthy. So we must be able to make sure that we are reciprocating. We also have association. This is a cordial relationship, but there is no depth. When I say an association, we look at maybe the association of nurses, whereby we are just interacting at a professional level, but we don't go into each other's business. We mind our business, but we are just there associating as nurses. So why is it important for you to know this relationship? so that you just know how to deal with people. For example, receptivity. You have to know that the patients in your care, they deserve to receive good care from you, even without giving you anything. That is okay. Characteristics of interpersonal relationship. So it is an intellectual and emotional bond between the nurse manager and the nurse, and is focused on the goals of the organization. So we are talking about the interpersonal, you can say the inter-nurse relationships, whereby the relationships we share with our in-charges and our fellow nurses. So respect to the subordinates as an individual, including maximizing the subordinates' abilities to participate in decision making and treatment, considering ethnic and cultural aspects, considering family relationships and value. So, okay, this is trying to just show the characteristics of the relationships we have in hospitals. But no, when we look at the word characteristics, it's just trying to tell us like, tell me the traits of these interpersonal relationships, or what are some of the things that we see in interpersonal relationships. So there must be respect. Yeah, these relationships, we must respect each other. If my friend is a Muslim, or those people who wear, I don't know how you call them, there are those women who wear things on their head. If they are supposed to wear that in a word, we must respect them. If they say, no, I'm a Jehovah's Witness, I will be needing assistance with transfusing blood, we must at least respect their decision, unless there is no alternative. But we must try by all means that our interpersonal relationships are made up with uh, respect. Respect clients' confidentiality, focus on clients' well-being, and is based on mutual trust and respect acceptance. So this is what we've learned today. That is the end. We've talked about communication, communication skills, the process of communication. We've talked about the barriers of communication, as well as how to improve communication. We've also talked about the interpersonal relationships. We'll talk about team building in the next lesson. Of course, team building is not something that is very difficult. So we will look at it maybe for a minute, then we'll move to unit 4, where we'll discuss some other things. Yeah, hopefully you're able to remember what we've discussed today. In a nutshell, communication is simply the exchange of information from one person to another. For example, a nurse writes a report in the morning for the afternoon nurses. That is the communication. Communication begins from the sender, then must go through a channel, then to the receiver, then they must send feedback back to the sender. We have barriers of communication such as the physical barriers, physiological, psychological, as well as the other barriers such as noise and the rest. We also talked about some principles of communication, where I said communication, when we say principles, we're just talking about things that guide communication. We talked about empathy, we talked about respect, we talked about confidentiality. All those are some of the principles that we must respect in the profession of nursing. My name is Kelvin. Thank you very much. If you want some more tuitions, please feel free to text me on the number on the screen, as well as follow me on Facebook. My name is Kelvin Sikombe. Thank you.